Today I'll talk on painful periods. Is it normal to have pain during periods? What is to be done if you are having painful periods? Hello everyone, I'm Dr. Prachi Kulkarni, fertility specialist, Ferty9 Fertility Center, Banjara Hills. So usually when a lady or a woman gets periods, there will be little discomfort. There might be mild lower abdominal pain with little back pain, lower back pain, or there might be generalized weakness during periods, or somebody may get leg cramps during periods. But all these are milder symptoms with which you can carry out your day-to-day activity. But sometimes you may not be able to do some extra physical work, like some strenuous physical activity. So this is how the normal periods would be. Somebody who has periods where the pain is so severe that they are not able to continue their day-to-day activity, like going for work or college, or they are not able to do small works like cooking or sweeping in the house, they have to use medications for the pain, then that is not normal for a woman. So why the painful period happen? So painful periods can happen because of certain medical conditions, and it is very important to know the cause for the painful periods, because if we normalize painful periods, these conditions may go unnoticed and may have further effects, like it may result either into bigger problems, or it may result into infertility. So if you have painful periods, it's better that you get your ultrasonography of uterus done by a fertility specialist or a good sonologist, where you will come to know if there is any reason for painful periods. So what are the reasons for painful periods? So the common reason is fibroids of the uterus. So fibroids are actually benign tumors of the uterus, and they are very common. Almost 50 to 70% women of reproductive age may have a fibroid, but not all fibroids will result into symptoms, or they will result into menstrual pain. So first reason is fibroids. Second reason could be endometriosis. What is endometriosis? Endometriosis is a condition where the lining of the uterus, which is called endometrium, that endometrium like tissue is implanted on organs other than the inside of the uterus. So this is the lining which lines the inside of the uterus, but sometimes it may be present on the surface of the uterus, on the tubes, on the ovaries, or other abdominal organs, or sometimes at different sites also. So this is called as endometriosis. So what happens in endometriosis is this tissue is hormone sensitive, means how you get periods, like the endometrium will undergo serial changes so that it prepares itself for receiving the pregnancy. So similar changes happen to the endometrium like tissue which is implanted at other places. But if there is no pregnancy, this lining of the uterus sheds off in the form of bleeding. So the similar changes happen in this tissue which is implanted at other sites. So bleeding happens at those sites also. So because of this bleeding, because of there is increased blood flow to these areas, because the body tries to control that bleeding, then the inflammation happens, and which causes pain. So endometriosis is another condition where it can result into painful periods. Third reason can be a pelvic congestion, means the blood vessels to the pelvic organs like uterus, ovaries, tubes are bigger than the normal. So this pelvic congestion can happen because of multiple reasons, most commonly because of infections, pelvic inflammatory diseases, or sexually transmitted infections which can cause inflammation of the uterus or the tubes or the ovaries. So these pelvic infections can cause pelvic congestion. Even sometimes in endometriosis, there might be pelvic congestion which causes period pains. So we saw these three main reasons which we can diagnose on ultrasound. One is fibroids, second is endometriosis, third is pelvic congestion. So now coming back to fibroids. So as I already mentioned, not all fibroids will cause pain. So the fibroids which are present completely outside the uterus, they may not cause any symptoms to the lady. So those fibroids are most of the times asymptomatic. The fibroid which is in the wall of the uterus can cause period pains. So because that fibroid is also a hormone sensitive tumor, it has good blood supply. So because of the congestion, because of it being obstructing in the wall of the uterus, when the uterus contracts, it may not contract properly, and the fibroids can cause menstrual cramps. So the fibroids which are present in the wall of the uterus, we call it intramural fibroids. These fibroids can result into menstrual pain. Now coming back again to endometriosis. So endometriosis also can be diagnosed on ultrasound, but you need to get the scan done from a proper expert. So this actually, it's known that many studies have mentioned now that this condition goes unnoticed for up to 7 to 10 years till somebody actually diagnoses it as endometriosis, because even today there is lack of skills or lack of awareness that the endometriosis can be diagnosed on ultrasound. So you need to visit a proper expert who can diagnose endometriosis on scan and who can give you the reason for your menstrual pain. So nowadays, with the help of advanced techniques and advanced scan machines, it's possible by a skilled expert to diagnose endometriosis on scan. Earlier, the diagnosis of endometriosis used to happen only at the time of laparoscopy. So laparoscopy is a surgery where we put in the camera into the abdomen and we visualize the inside of the abdomen. So because this is a surgery, it's an invasive procedure. So not all may require to undergo this surgery just to diagnose endometriosis. So you have to visit a proper fertility specialist who's expert in diagnosing endometriosis on ultrasound. Now coming back to the pelvic congestion. Pelvic congestion means when we do the scan at the time, along with the uterus, tubes and ovaries, we also visualize the blood vessels which are supplying these organs. So we sometimes see that these blood vessels are dilated. They are bigger than the normal size. There might be some fluid accumulation around the pelvic organs. There might be some adhesions which we see around the pelvic organs. So these can cause pain during the periods. So all these three conditions, it's possible to diagnose on ultrasound by a skilled specialist. So if you have unusual period cramps where you have to take rest or you have to take medications to reduce the pain, then please consult a proper fertility specialist who's expert in diagnosing these conditions on scan and get yourself evaluated so that you can come to know the reason for this pain, and based on the reason we can advise further. So usually young girls or unmarried women, we do not advise to go directly for surgery. The management usually happens with medications based on what is the diagnosis, where exactly is the fibroid or where exactly are the endometrial deposits. Based on that, we give the medical management. Surgery is advised only when it is causing severe symptoms or when it is either resulting into infertility or resulting into severe blood loss during periods, causing severe anemia where somebody is requiring repeated blood transfusions. So surgery usually we advise only for correction of something which needs to be done, but mainly it is medical management. Even if somebody requires surgery, it's better to evaluate the entire case properly, consult expert in the surgery for fibroids or endometriosis, treatment or further surgery. So even if you require surgery, do proper analysis of the case, consult a well-known skilled doctor who's expert in doing these surgeries, and get it done only when it is required and when there are no other options for treatment. So if you have painful periods, better you consult a proper fertility specialist who can diagnose these conditions on scan and who can guide you further. Thank you.